Definition isn't there, but this is we haven't actually said what the definition is, and one of the definitions that we've been looking at is conversion therapy, sometimes referred to as reparative therapy, is any of several dangerous and discredited practices aimed at changing an individual's sexual orientation or gender identity. Conversion therapists use a variety of shaming, emotionally traumatic, or physically painful stimuli to make their victims associate those stimuli with their LGBTQ identities. It's estimated that about 700,000 members of that community have been subjected to this over the last many years, and expected that many tens of thousands more in the coming.
It will be a stake in the ground that this barbaric practice is socially unacceptable.
It will be a stake in the ground that this barbaric practice is socially unacceptable.
I got an email from a gentleman, and I won't name who it was, but he emailed me over the weekend and talked about how his life had been completely destroyed. And the email itself was very disheveled. And it was very sad to read because it was not articulated well. But you could tell he identified his life as having been destroyed by this. He had gone through electric therapy. And over many years, they destroyed his life. And that's unacceptable. That someone who has a different gender or sexual orientation could go through such a horrific thing and have their life destroyed just breaks my heart. And particularly because we know it's happening to kids.
You too. Yes? Eh? Quite a good scene, isn't it? One man crazy, 3 very sane spectators.
Hello, I'm Dr. Ian Heath, the Senior Physician Director for the Psychiatry Service Line, and thank you for watching this video. It's going to be a very brief talk about ECT. So ECT, or Electra-Convulsive Therapy, is a treatment modality that was invented in the 1930s by Dr. Ugo Giletti, an Italian neuroscientist who first used electricity to elicit a therapeutic seizure. Historically, it was used in the treatment of schizophrenia, psychotic disorder. ECT fell out of favor in around the 1950s when the psychotropic medications were brought to market. ECT also was oftentimes, there was a lot of misperception about it. People didn't understand it, and when you talk of ECT, most people of course think of various products out of Hollywood. 60, 70, 80 years later now, from Dr. Giletti's time, we're now seeing a massive resurgence in the use of ECT. Why? ECT has proven many times through many studies to be more effective than many of the psychotropic medications. It can also be a useful adjunct to the psychotropic medications, as well as various refinements in anesthesiology and the actual technique means it has a much more favorable side effect profile than it did historically. In the United States, about 50,000 people receive ECT per year. ECT predominantly is used for the treatment of depression. However, it can be used in various other ailments, inclusive of manic depression, as well as an adjunct in treatment-refractory schizophrenia. ECT is done in our post-anesthesia care unit here at HCMC. What occurs is that the patient is brought down to the post-anesthesia care unit and an IV is put in place. The patient's administered both an anesthetic and then a muscle relaxant. And when they're asleep and the muscles are relaxed, the electrical stimulus is then passed across the brain via just 2 handheld paddles. A very attenuated seizure is the result, and it's through the seizure that we are able to obtain the therapeutic effect, which is believed related to a release of a series of neurochemicals in the brain. The entire procedure lasts approximately 5 minutes, so it is quite rapid. Here at Hennepin County Medical Center, we do approximately 3,000 ECT treatments per year. We have remodeled the post-anesthesia care unit, the recovery area for outpatient ECTs, as well as have created an ECT clinic via which we're able to follow patients throughout their course of treatment, whether it be solely a short series of ECT treatments or ongoing maintenance therapy. Thank you for watching this video, and I hope you found it informative. Thank you.
It will be a stake in the ground that this barbaric practice is socially unacceptable.
In 1982, a young nurse was suffering from severe, unrelenting depression. She couldn't work, socialise, or even concentrate well enough to read the newspaper. One treatment changed everything. After 2 courses of electroconvulsive therapy, or ECT, her symptoms lifted. She went back to work, then on to graduate school, where she earned high grades. At first, she talked openly about her life-changing treatment. But as she realised many people had an extremely negative impression of ECT, she stopped sharing her experience. ECT carried a deep stigma, left over from a history that bears little resemblance to the modern procedure. The therapy was first used in medicine in 1938. In its early years, doctors administered a strong electrical current to the brain, causing a whole-body seizure, during which patients might bite their tongues or even break bones. Modern ECT is very different. While a patient is under general anaesthesia, electrodes deliver a series of mild electrical pulses to the brain. This causes huge numbers of neurons to fire in unison. A brief, controlled seizure. A muscle relaxant keeps spasms from spreading to the rest of the body. The only physical indication of the electricity flooding the brain is a twitching foot. The treatment lasts for about a minute, and most patients are able to resume normal activities about an hour after each session. ECT is commonly used to treat severe cases of major depression or bipolar disorder in patients who haven't responded to other therapies or who have had adverse reactions to medication. Half or more of those who undergo treatment experience an improvement in their symptoms. Most patients treated with ECT have 2 or 3 sessions per week for several weeks. Some begin to notice an improvement in their symptoms after just 1 session, while others take longer to respond. Patients often continue less frequent treatments for several months to a year, and some need occasional maintenance sessions for the rest of their lives. Modern ECT is much safer than it used to be, but patients can still experience side effects. They may feel achy, fatigued, or nauseated right after treatment. Some have trouble remembering what happened right before a session, for example, what they had for dinner the previous evening. Rarely, they might have trouble remembering up to weeks and months before. For most patients, this memory loss does improve over time. What's fascinating is that despite its proven track record, we still don't know exactly why ECT works. Neurons in the brain communicate via electrical signals, which influence our brain chemistry, contributing to mood and behaviour. The flood of electrical activity sparked by ECT alters that chemistry. For example, ECT triggers the release of certain neurotransmitters, molecules that help carry signals between neurons and influence mental health. ECT also stimulates the flow of hormones that may help reduce symptoms of depression. Interestingly, ECT maintenance works better when paired with medication, even in patients who were resistant to medication before. As we come to a better understanding of the brain, we'll likely be able to make ECT even more effective. In 1995, more than a decade after her first course of ECT, the nurse decided to publish an account of her experience. Because of the stigma surrounding the treatment, she worried that doing so might negatively impact her personal and professional life, but she knew ECT could make a difference for patients when all else failed. Though misperceptions about ECT persist, accounts like hers have helped make doctors and patients alike aware of the treatment's life-changing potential.